Right now, many scientists are trying to find a cure for COVID-19. But when and what will be the cure? Well, there are many treatments underway to test the most promising treatments along with other alternatives. We chose these treatments as being the most promising. Number 1. Convalescent plasma therapy. The immune system has a protective mechanism built to fight off possible infections with something called antibodies. Antibodies are proteins created by the body to fend off a variety of diseases. Many people who survive an infection are left with many antibodies that have already fought off the infection. So scientists are using the antibodies left from those who have already beaten the disease to treat patients who are ill and need those antibodies to fight off the same virus. These antibodies are collected in the form of convalescent plasma from the patient's blood. Plasma is separated from the rest of the blood by rotating the blood and separating it in the centrifuge. The plasma is injected into the patient intravenously through an IV. This method has been used to treat other diseases with no known effective treatments such as SARS and Ebola. Right now, the Mayo Clinic and Michigan State University are paving the way for using convalescent treatment to treat mild to critical patients. Now the risk of using this method. Well, not very much has been researched about using convalescent plasma therapy with COVID-19 patients. The person receiving the plasma might get the infections that the plasma donor might have had. That includes the risk of contracting COVID-19 and other infections such as HIV and hepatitis B and C. Although it's highly unlikely due to the fact that only fully recovered donors were chosen and the blood is most likely going to be tested for possible diseases. Other possible risks include allergic reactions, lung damage, and difficulty breathing. Although not many studies have been conducted around convalescent plasma therapy, it has the possibility of increasing the chance of survival. Number 2. Antiviral. Antiviral treatments are those that stop the virus from hijacking the cell's machinery and producing more copies of itself. Antiviral treatments have been used for other viral infections such as HIV. Remdesivir is one of those antiviral treatments that have been used for HIV, Ebola, MERS, and recently COVID-19. Although remdesivir has shown only modest results of decreasing the hospital stay from 15 days to 11 days, a novel antiviral treatment called EIDD2801 also attacks the same viral enzyme, RNA-dependent RNA polymerase, similar to remdesivir. However, EIDD2801 can be taken as a pill compared to intravenously for remdesivir. Number 3. Monoclonal antibodies. These antibodies are laboratory-made molecules that mimic antibodies by binding to the same epitope, the site of antibody attachment to pathogens, as natural antibodies. They can target a plethora of diseases and infections ranging from cancer cells, asthma, Crohn's disease, rheumatoid arthritis, to viruses. There are monoclonal antibodies being studied that target specific regions of the coronavirus. Recently, researchers identified unknown antibodies in a COVID-19 survivor that blocks SARS-CoV-2, the viral infection that causes COVID-19, from attaching to the human cells. They then created multiple copies of each antibody and tested them on mice, and results showed that the viral materials in the mice's lungs decreased as much as 30%. One more advantage is that this class of therapeutics has a shorter development, testing, and approval timeline than drugs made out of chemical compounds. That makes monoclonal antibodies a great short-term solution for COVID-19. Number 4. Immune modulators. Immune modulators are drugs that mostly suppress the immune system and are widely used to combat inflammatory responses from the immune system. One of the main reasons that immune modulators are being considered for COVID-19 treatment is that the later stages of COVID-19 infection results in an increase in inflammatory cytokines that result in hyperactivity of the immune system. The overproduction of cytokines by aberrant immune activation is known as cytokine storm. and it is found in later stages of SARS and MERS also. Cytokine storms can result in death. It is counterintuitive to suppress antiviral responses of the body to defeat a virus. However, that fact plays a crucial role in patient survival. Doctors need to consider the right time, route, and dosage of these medications to effectively treat COVID-19 and other potential viruses so that the use of immune modulators do not increase the chance of mortality for the patient. More research needs to be done to increase the efficacy of immune modulators and their potential to aid more patients. Number 5. AI. The White House launched the COVID-19 High Performance Computing Consortium on March 23, 2020 to combine the world's most powerful high-performance computing resources that can advance scientific research and treatments for COVID-19. The consortium includes IBM, Amazon Web Services, Google Cloud, Microsoft, Hewlett-Packard Enterprise, MIT, RPI, and other federal agencies. This consortium is designed to use computing and artificial intelligence to identify various treatment methods and possible existing drugs that can be repurposed to combat COVID-19. Number 6. Hydroxychloroquine and azithromycin. There have been many studies conducted around the potential of hydroxychloroquine and azithromycin being the cure for COVID-19. Hydroxychloroquine is an oral medication that has shown efficacy against malaria, rheumatoid arthritis, and lupus, but with no conclusive data on its efficacy against COVID-19. Azithromycin is an antibiotic that has shown efficacy for treating bacterial infections, respiratory infections, skin and ear infection, in addition to STDs. Currently, many early small sample studies have found hydroxychloroquine in conjunction with azithromycin to be effective against COVID-19. These studies were done in vitro, in the labs, and not human tests. Subsequent studies have found that hydroxychloroquine does not have sufficient impact on health improvement of COVID-19 patients. Health experts caution people from taking these medications, which can include side effects such as irreversible visible changes, long QT or prolongation, abnormal heart rhythm, muscle weakness or nerve pain, hypoglycemia, and many more. Experts are more concerned about people who take both hydroxychloroquine in conjunction with azithromycin, as the pair have shown to exacerbate side effects such as abnormal heart rhythm. Both medications should only be taken in the presence of medical professionals in a hospital setting or a clinical trial. More studies need to be conducted to determine the efficacy of hydroxychloroquine due to the lack of rigorous design of previously mentioned studies, and in addition to potential design flaws in the studies. Currently, better clinical trials by the National Institutes of Health, University of Washington, and Rutgers Cancer Institute are underway. Number 7. Dexamethasone. Very recently, the world's biggest trial testing in Oxford University has yielded promising results with a cheap, widely available drug called dexamethasone. The recovery trial that began in March of this year has undergone many clinical trials of a wide range of drugs that could potentially be an effective treatment against COVID-19. The recovery trial has found that dexamethasone most likely suppresses the body's hyperactive immune responses against COVID-19. The drug has already been found to be effective against arthritis, asthma, and some skin conditions. The study has found that dexamethasone is only effective for patients on ventilators and oxygen, with no sufficient evidence that it helps patients with mild symptoms. The trial tested 2,104 patients with 6 milligrams once per day for 10 days compared to 4,321 patients as control with usual care alone. Dexamethasone reduced mortality rates by 40% to 28% for patients on ventilators and 25% to 20% for patients on oxygen. The cost-effective abundant drug is a breakthrough, and one of the chief investigators of the recovery trial is calling for dexamethasone to become the standard of care for patients on oxygen and ventilators. Subsequently, it would cost just 5.4 pounds, equivalent to $6.78 a day for the treatment, totaling to 54 pounds for the entire treatment, which is about $67.80. This drug is the first drug proven to cut deaths from COVID-19 and should be celebrated as it has global implications. The only other drug shown to benefit COVID-19 patients is remdesivir, which only reduces the hospital stay from 15 days to 11 days and is limited with the price unannounced. Consequently, the recovery trial has found hydroxychloroquine to be ineffective and abandoned clinical research into its potential benefits amid concerns of increased fatalities and heart problems. If you have any other suggestions for other possible treatments, please leave them in the comments below. Also, if you have suggestions for the next video, you can leave them down in the comments also. Thanks for watching.